Hey, we are joined now by infectious disease specialist Dr. Zain Chagla this Friday morning for his weekly update on COVID-19 and vaccines and lots more. Good morning. Good to see you.
Hi, good morning, Bob.
Since we last spoke, the province laid out its longer-term roadmap to full reopening. I wanted to get your thoughts on that. Any flags or concerns?
Yeah, I mean, I think Dr. Kieran Moore put it out really nicely in an article. He kind of said these are our, anytime we invoke restrictions, we have to have an exit point for them. They're not set in stone. They'll follow the evidence. They'll use data to suggest whether or not, things need to remain a little longer or shorter. There are some people that are concerned, I think, that, taking the vaccine mandate out in January is a problem. But again, I think we can always reevaluate situations when they come. And again, as he said, when we put these things down, we have to give a pathway to normal for people. Otherwise, people feel like this is never going to end.
Yeah, it becomes more and more of an issue as the fatigue with this thing grows. Now, there's a lot of developments we got to talk about on the treatment side. We were talking about this yesterday, an international study co-led by McMaster University with Fluvoxamine. So with this, what is it like to the tune of reducing hospitalizations? It was done in Brazil, and it was reducing hospitalizations, to the tune of 30%?
Yeah, absolutely. So lots of prospective stuff. This is a pretty good study that was done in Brazil out of McMaster and a number of other colleagues. People got fluvoxamine, which is an anti-psychiatric medication, but has some effects on inflammation and platelets. They saw a reduction in hospitalization. Now, it's a little bit unclear. It was a reduction in being in the emergency room for 6 hours, which in Brazil is a surrogate for hospitalization. It's prospective. I think there is still a little bit more study needed with this drug, but there's a couple of trials that will come out in the United States in the coming weeks and months. If they really do consistently show this benefit, it's a cheap therapy. It's easy to administer. It's generic. There shouldn't be supply chain issues globally. And so, this is one that's hopeful that it comes to the market. It just needs a little bit more study before we make it prime time.
Right, yeah. But if it is effective, it's been around, since the 90s as an antidepressant. Now, how does it compare with the Merck antiviral that's coming?
Yeah, I mean, they saw a 30% reduction in hospitalization as compared to 50% in the Merck trial. That trial was actually also done in Brazil and Latin America, too. So, again, it's unclear if they would compare head to head. But, again, more tools are better than less tools, right? And for the cost standpoint, the fluvoxamine would be a whole lot cheaper and generic. Let's hope both of them work, but again, more study needs to be done.
Well, yeah, and actually that was a big development because Merck said it will have released the licensing and allow generics to be created for its drug. Which, how much of a game changer is that?
Yeah, absolutely. Look, vaccines, we're talking about the problems, right? About vaccine manufacture being centralized, rich countries having more access to vaccines. This is a good move. This is saying that the world can have access to this drug. It doesn't necessarily have to be a barrier for a country's resources. It would be much better if vaccines were there too, but, at least this is a good start into the realm of making therapies for COVID-19 much more globally accessible.
Yeah, and still on the treatment side, can you update us on your new outpatient clinic that you talked about last week, providing infusions for certain high-risk groups? How many referrals are coming in?
Yeah, we're getting a few. The good news is Hamilton is actually doing pretty well in terms of its COVID-19 rates. But we've found individuals that are willing to go get their infusion. We've been also helping regional partners, even as far as Toronto. We are giving doses every day and seeing very good effects of it. And so, again, we're just encouraging everyone out there, regardless of your vaccine status, if you have symptoms, please get tested because it can set up the ability for us to then treat you and keep you out of hospital.
Yeah, and we're out of time, but we'll leave it on this note. I mean, all these treatment breakthroughs are great, but the best treatment is vaccines, right? Get it in your arm.
Absolutely.
Yeah. Hey,
exactly.
Hey, good to see you. We'll talk again next week. Infectious disease specialist Dr. Zain Chagla. Have a great weekend.
Take care.